My name is Dr. Andrew Wei from the Alfred Hospital in Melbourne, Australia. Today I'm going to talk to you about the results of the VIALE-C trial. This was an abstract presented at the European Hematology meeting. This was a virtual meeting because of the COVID situation. VIALE-C was a 211 patient trial which was conducted in older patients with acute myeloid leukemia. About 50% of patients, particularly in older age groups, are unable to tolerate intensive chemotherapy. Therefore, this trial was an attempt to try and find a less intensive therapy, which was felt to be better tolerated by older people, not suitable for intensive chemotherapy. Traditionally, low-dose Ara-C is a form of chemotherapy which is injected into the tummy, and it's given about 10 days each month. Response rates with low-dose Ara-C chemotherapy alone are not particularly good, with response rates of less than 20% and expected survival outcomes of less than 6 months. There's been a long search for new drugs which could be combined with conventional low-dose chemotherapy to try and improve outcomes for older patients with acute myeloid leukemia. This trial was a randomized study which combined low-dose Ara-C with a new drug called Venetoclax, which is designed to target BCL2, which is an important survival protein for leukemic cells. The trial was conducted whereby patients received either Venetoclax in combination with low-dose Ara-C or a placebo tablet. Venetoclax was given after a short dose escalation to a level of 600 milligrams, and this was continued through for 28 days each cycle. The low-dose Ara-C was given in the normal manner as a dose of 20 milligrams per metre squared, given by injection into the abdomen for 10 days each month. The primary endpoint of the study was overall survival, and with an extension of 6 months in the follow-up, the results presented at this meeting show that low-dose Ara-C plus Venetoclax results in an improved survival for older patients with acute myeloid leukemia. The combination extended survival from an average of 4.1 to 8.4 months. Furthermore, response rates with low-dose Ara-C plus Venetoclax were substantially higher, with almost 50% of patients achieving what we call a complete remission, which is predominant clearance of the bone marrow of leukemic cells to less than 5%. As I mentioned, this was achieved in almost half of all patients receiving Venetoclax plus low-dose Ara-C, compared to only 13% of patients receiving low-dose Ara-C alone. The combination of Venetoclax plus low-dose Ara-C resulted in twice the rate of transfusion independence, which has important implications for patients in terms of not needing to have recurrent blood transfusions and platelet transfusions. Furthermore, the duration of remission achieved by low-dose Ara-C plus Venetoclax was again twice that of low-dose Ara-C alone, with an average duration of remission of 12 months compared to only 6 months for patients receiving low-dose Ara-C by itself. Therefore, the results of the VIALE-C study demonstrate improvements in survival, improvements in response rates, higher transfusion independence, and all these things go together towards improving the outcome of patients with acute myeloid leukemia in older age groups where patients are often not fit for intensive chemotherapy. This study complemented another trial called VIALE-A, which combined Venetoclax with another drug called cytarabine. That study was also positive, and therefore these two trials support each other in cementing the role of Venetoclax as a new therapy for older patients with acute myeloid leukemia.